Full swing, many kids are back to playing fall sports, and along with the exciting games also comes the risk of injury. News 8's Lisa Carberg spoke recently about concussions and head safety with Dr. Stephanie Alessi-LaRosa. She's the director of Hartford Healthcare Sports Neurology Program.
Dr. Alessi-LaRosa, thanks for joining us. Let's get right into it. How common are concussions and what are the most likely causes?
Possible with any sport or recreational activity, but in terms of fall sports, things like football, rugby, and soccer are the most likely to cause concussion.
All right, doctor, tell us about the concussion symptoms and what people should be looking out for after a head injury, maybe even a minor one.
Sure. So common symptoms of concussions are things like headache, dizziness, light or sound sensitivity, and nausea, as well as visual changes. But really dangerous or red flag symptoms are intractable or repeated vomiting, any weakness or numbness anywhere in the body, severe headaches, and decreased alertness. And that should be evaluated in an emergency room right away.
All right. And now how do you determine whether or not someone has a concussion?
Concussion is a clinical diagnosis, so it really involves seeing a specialist and having a thorough history taken in terms of how the hit happened and the symptoms that have produced from the concussion. And also, really doing a detailed office examination, neurologic examination, including their balance, eye tracking, and coordination, etc., is really important.
How do you treat a concussion? What is the protocol these days?
Sure. So treatment really should focus on symptom management as well as following a stepwise return to play process before returning to contact sports.
All right. What should people do to protect themselves from concussions?
Yeah, to protect against future head trauma or head trauma in general in sports, it really is important to have good coaching for blocking techniques, in particular with football, fewer contact drills during practices, and even neck strengthening has been shown to prevent and reduce concussions.
And doctor, talk about in school systems, are there more professionals in school systems to actually work with the athletes, train the trainers to recognize the signs?
Yeah, the state of Connecticut has done an excellent job of always having education every year for coaches, parents, the student athletes themselves, as well as the athletic trainers.
All right, and what should an athlete do if they think they're injured?
They should definitely report any symptom immediately. In case it is a concussion, we do want to remove them from play immediately. So it's very important for them to advocate for themselves.
All right, Dr. Stephanie Alessi-LaRosa, Director of the Hartford Healthcare Sports Neurology Program. Thank you so much for taking the time to be with us. Great information.